Hello, Maddie here again. Just wanted to get another video in. Shit, my life went down last night, and this morning was kind of good. It was a good morning. It was a good morning. Something I wanted to talk about, just a flaw in what we have going on. It seemed to be a theme this morning. My buddy Ray brought me to therapy this morning, which went really well. I talked. I don't seem to have a problem talking to people. I talked about things I don't necessarily like to talk about. Life, my childhood life, and my life in South Boston, stuff like that. But I ended up last night. I got home. I did a little bit of sanding on sheetrock at my girlfriend's place and touched that up a little bit. It's all ready to prime. I'm going to texture the ceiling. It'll come out really nice. Maybe I can throw pictures of it up because renovations on that place will be a common theme because I don't like doing renovations. I like fresh construction, like redoing siding's one thing, fucking stuff like that. If you've got to frame up a knee wall and sheetrock it, it's always easier than just fucking tearing down horsehair and all that. But got out, went and had coffee with my friend Kate, someone I worked with at my last job for 2 years. I watched her get sober. Fucking really good person, one of my close friends, and had coffee with her. It was something I never could do with my ex. I couldn't be with other females. Some trust issues. Ones I didn't actually create in that relationship. I have some in this relationship towards me. I've lost trust, but it can be built back up. I know what I feel in my heart and what I'm doing, and I have faith that everything will work out the way it's supposed to. But had coffee with Kate and shot the shit, got her up on me kind of being self-employed, working 7 days a week, more often than not, but 5 of those are my own work, what I choose to do. I bid jobs, I go do the jobs, I get paid for them, I don't pay anybody else. It's a lot of profit in it for me. I can make, some jobs I do, I make $100 after material, so I make $100 for fucking 6 hours of labor. That sucks. Job I did a couple towns over last month, I was able to recycle some material I had, and some material from some demo I had to do at that actual job, and I saved $500 on material that went in my pocket, plus $600 for labor. So it was $1,100 for a week of work. And then I did nothing for a couple weeks, and it's nice. So I filled her in on stuff like that, showed her some of the projects I did around town. Different vendors had me, replace their shop stairs, stuff like that, windows, doors. So filled her in on that, got back, and my girlfriend has been having abdominal cramps and pain and abnormal bleeding, and I got here and she's all curled up, and she got a phone call. She had given her doctor the symptoms, and they told her to go to the emergency room. So we went to the emergency room. When I had to get my, I had a bad infection in my tooth a couple months ago. She was there with me, her and her friend. Sat there with me, made sure I was okay, kept me company. And I noticed a problem there that I've kind of always known about at a hospital. But we were there. We were there 4 hours. We got there at 6. We got home at 10. We live 2 minutes away from the hospital. It's right down the street. It's a satellite hospital, which is nice because this is a small town, but it's apparently big enough to have a satellite hospital. But we were there 4 hours for 5 vials of blood, them to check her blood pressure, do an ultrasound, and a CAT scan. And I was infuriated almost the whole time I was there, and I don't like being at hospitals. I don't like what they mean to me. I don't like a hospital. I don't. I tie them in with death, saying goodbye to people, being abused as a kid, ending up in the hospital. Like, it was never, you never go to a hospital for a good reason. And in my head, there's never a good reason to go to a hospital. I won't go. I was in severe pain when I went. She was in severe pain when she went, and I went with her. It doesn't matter if I'm irritated. I'll sit there next to her. I'm trying to make sure she's okay. We had a long argument about me wanting to go in the service again while in the hospital. If anything, it killed time. But an issue I had that I always seem to have in hospitals, which I try to accept because I don't know the job, I've never done it. But when you hear people out there and they're talking about parties they're going to throw or fucking what they did over the weekend, they're just sitting there bullshitting. Like, I do that on my job too. I've worked in factories for 4 years, and now I guess subcontractor is what I've been doing. I'm getting licensed and bonded next week. But they're just sitting there bullshitting, and we're sitting there waiting and waiting. They did the CT scan. They said it had to go to some fucking place in Boston. They're going to look at it, give their opinion, send it back. The doctors at the hospital are going to look at it and then formulate a prognosis. Pretty standard. They said it should take around 20 minutes. It's going to get sent to Boston, which I'm like, in my head, I'm like, it's fucking email. Like, what are you possibly sending? You don't need to carry your pigeon or anything like that. So it's 30 seconds, and there you go. They have it. And then they got to look at it. Granted, they could be looking at other shit. They could have stuff going on. You know, she wasn't in any immediate danger that we knew of, so someone gets a gunshot at the hospital in Boston they sent it to, they get a gunshot victim. Of course, fucking, maybe we look at this after they're stable and they're okay and everything's good. They go 20 minutes. I was like, okay, that's fine. Stay here for another 20 minutes, no problem. After I'd already been in there for 2 hours, because it took probably an hour for the doctor to actually see us, which I watched him sit at a computer. I watched him play Candy Crush on his phone for 25 minutes. That's fucked up. He comes in, sees us. They do the ultrasound. They found a rather large hemorrhagic cyst on one of her ovaries. It's common. It's not a big, huge thing. 4 by 5 centimeters. It's a little. It's, I think he said 4 times the size of what they normally see. So that's going to be removed in the future. But so the doctor says that they take her blood, make sure she doesn't have any infection going on or anything, because she was having chills, feeling like she's going to throw up, feeling like she's going to faint, having kidney pain, and from the infection I had in my leg. It almost killed me, and that's where my head went when she told me her symptoms. I'm like, it sounds like sepsis. It's a blood infection. I didn't tell her that. I was like, that's what the symptoms sound like. Could also be copper intoxication. The IUD she has is copper-based. I was like, it could also be that. It could be a plethora of things. You might just be having pain, because, I'm sorry, females, you have pain. That sucks. I don't walk around with my balls hurting. They just are there. They never cramp up or cause problems. So the doctor had called her and sent us to the hospital. We do all that stuff, run through, get blood work drawn. Nobody ever seems to be on the same page. Everybody that comes in the room has to ask you the same fucking questions. Oh, what brings you in here? What are your symptoms? And usually when it's me, I'm like, look, I'm only going to say this once, so like, get the other 6 people that have to fucking hear it, because the story's not going to change. I understand where they're coming from, because back in my past, 5 years ago, I was usually going in there to try to get Percocet. So I'd say anything I needed to say. I would lie to try to get Percocet. Even me, I'm gifted in my ability to lie and stick to a lie. After the 7th person, the story doesn't match up anymore. So that's a lot of what they're doing. They're just trying to make sure you're not full of shit. Also, you can be talking to somebody and remember another symptom from a couple days ago, so that helps. So that makes sense. But 7 people, you could tell they weren't communicating with each other. The lady that came in for the blood also asked for a urine, and she was about to do it, and I was like, you can't take a urine. The nurse got all fucking pissed off at me. I was like, the doctor just said they have to do an ultrasound, and she needs a full bladder. I was like, she cannot take a urine right now. Is it any way she can take the urine after the ultrasound? Because they just made her drink a bunch of water anyway, so she's going to need to go. I was like, it makes sense to me. She's like, oh, I don't think the doctor said that. My girlfriend goes, no, he did. I forgot. He's, wants me to have a full bladder for an ultrasound so they get better contrast. She gets all pissed off. She goes, finds the doctor. Fucking half hour later, she comes in. And she's like, oh yeah, it turns out you do need to have a full bladder for the ultrasound. As she's saying that, the doctor's behind her with the ultrasound machine. I was like, okay, that's kind of fucking stupid. So they do that. She does the urine cup. They come in. They go, oh yeah, that's right. You do have this going on. There's a cyst there. We got to take a closer look at it, see what dimensions it is, stuff like that. See what we have to do with it. See if it's. They can tell if it's fluid filled, if it's tissue. Like they were thinking tumor, because it's a. I don't know the word for it. A whole. Like nest of fucking cysts. It's not just one. It's a few. So they were worried, tumor. So they were like, all right, you have to do the CT. They had to put an IV in her to get the contrast fluid in. When you go to do the actual scan itself, they give you a couple more. One's a saline solution just to clear everything out, and then the other one's a dye so they can see. And they give her the first thing. I forgot what it was. It was just I think that might have been the dye. I'm not entirely sure. They gave her something, and the nurse took the IV out. Okay? Courtney has never had a CT scan. I have had many. I've had to. I've been shot, stabbed. I've had to have CT scans. Check for soft tissue damage, see what the extent of trauma was. As she's taking it out, I told her I was starting to say she needs a CT scan, leave it. Too late, she already took it out. She's like, oh, well, we'll just put another one in. I was like, well, I hope next time you're at the doctor's, they continuously poke you when they don't have to because they don't think ahead and they don't go talk to each other. That's a lot of what it is. They don't communicate. They're all running around. I mean, shit gets done. She got treated. Cleanish bill of health, treatment plan all set up. They don't talk to each other. Like, any job I've ever done in a factory, you talk to people that are related to the job throughout the day. You see them, and you gotta be on the same page. It makes you more efficient, makes you more productive. Like, if they want to have that downtime to talk about what they're doing for the fucking weekend, if they did all their work as to the best of their ability, I know a lot of it is a waiting game, then they would have time anyway. They could talk about that shit anyway. Just get on the same page about real shit. You have no problem sitting there talking about fucking, oh, we're going to go to this place house and have fucking martinis for the night and we're going to play some board games. You can talk about that. You can't go, oh, the patient in room 2 needs this, this, and this. What are your plans for the patient in room 2? Oh, okay, so I'll do this first and then you can do these 2 things and I'll do this. Boom. Nobody's butting heads. Nobody's fucking stepping on toes. There's not fucking 4 people in a fucking room at once when it only needs to be 1. And then, so they do that. They do the CT scan, tell us about 20 minutes for Boston to look at it, and then probably another 20 minutes for them to get around to looking at it. 2 hours later. 2 hours fucking later, after I'm watching this dude play Candy Crush at the computer, not even looking into the computer, just sitting there playing Candy Crush. And I'm sitting there pissed. I was like angry, and Courtney goes, oh, where's your head at? We're very good about trying to say, where's your head at? Like, if we feel like something's off or something might need to be talked about. And I was like, no, it's not important. I'm here for you. We'll focus on how I feel if I still feel this way afterwards when we're home or tomorrow or whatever. Like, you're here in the hospital. You don't need to comfort me. Like, I'm here for you. It's fine. She kept pushing it. I got pissed. I started raising my voice. The nurse came in to see if everything was all right. I started chewing her out. And my big thing is, in my girlfriend's case, it was okay. They told her there's nothing they're going to do right then and there in the hospital. Follow up an OBGYN, get a treatment plan, get the IUD taken out, have the cyst removed if needed. Some of them do clear up on their own. Not a big deal. I've been in there I got stabbed in the femoral artery. When was that? 5.5 years ago when I was in Boston. We were fighting over a bag. He clipped my leg with a box cutter. Ended up halfway through my femoral artery. I bled to death in the street. A detail cop applied a tourniquet, got me to the hospital. Had they been doing what they were doing I've seen that happen. That happens all over the place. People die in hospitals that should not fucking have died. It's just that level of malpractice where they're fucking so caught up in their own fucking stupidity they're not doing their fucking job. Because, like, there's a point where Courtney was sleeping. I couldn't tell if she was fucking sleeping or she passed out. She had been saying the whole time that she was afraid she's going to pass out, felt like she was going to collapse, she couldn't catch her breath. She was sleeping that heavy. She's normally not that heavy of a sleeper. And she was fucking out. It was like someone knocked her out. And I started getting anxious. I'm sitting at the clock looking. I was like, it's been 40 minutes. Not one person has come in and said, how's everything going? She could have, like, that part of that's on me. I could have got up and, like, shook her, just check on her, piss her all off because I woke her up and she was sleeping. But check on her. Make sure she was alright. But what if she was there alone? Normally Thursday nights I go to a meeting. I wouldn't have been around. She would have gone to the hospital, told me about it, and been like, oh, you need me there. She probably would have said, no, it's alright. What if she had passed out and been laying in that bed by herself, having trouble breathing, struggling? Nobody's going to check on her because of a fucking bar you went to a couple weeks ago is more important. And I was saying that. I said that right to the nurse. I was like, people probably die every fucking day because of shit like this. Because she could have. She could have had a fucking bad blood infection. Nobody had those results for us yet. I'm sure they had them hours before. But we didn't have the results. She could have had a very bad sepsis. And she could have been sitting there dying if I wasn't there. And she was passed out. Nobody came in the room for over an hour. Like I did, I was sitting the clock watching it. Nobody came around. I got her a fucking blanket out of their little blanket warmer. Because I had asked the nurse to do it, and she completely fucking dismissed everything out of my fucking mouth. And I know there's fucking nurses out there that just fucking, they're in it. That's what they're doing. They make sure you're comfortable. They'll come, if they got downtime, they won't go talk to the fucking other nurse. If they don't need to, they'll come in and ask you how you're doing, ask you if you need anything, water, a blanket, like whatever. They'll do their job. There's people like that all over the place. Police are like that too. There's some that it's that ingrained in them to protect and serve. Those are the police I'm talking about where you hear they fucking held a kid in a fucking gunfight because there was fucking shit going down. They held a kid and died, and the kid lived. There's people like that in the service. There's firemen like that, police officers like that, security guards like that. There's people like that all over the place where they give that much of a fuck about people. That's where most nurses start. I think there is some level of, this is what I want to do with my life. I want to help people. I want to be able to save people, make people more comfortable. And it tapers off. Maybe that's something they didn't really want to do in that way. And now they're stuck with the career because they went to school for it for so long. So they're just stuck in it and they show up and it's a job. The triage nurse was very much like that. No bedside manner. She didn't really smile much. She wasn't mean. She wasn't a mean person. But you could just tell she was very coarse. Fucking run-of-the-mill. Fucking, oh, missed a vein. Fucking try again. Like, you know, if you don't fully, wholeheartedly want that job, don't take it. Don't. I've been making that mistake. I'm just a factory worker. I'm not. Nobody's life's on the line when I'm working. Sometimes, my 2 jobs back, there was cases. I worked with firearms. There was cases where my job didn't impact people's safety. If I was in the mentality of, oh, this is just another fucking job, I don't give a shit. This is possible, but I'm not going to worry about it. Someone could have died, and that's how I view nurses and doctors. Like, you got to be on top of your shit. Like, I know the hours are long. I understand. I don't even know how many times I've worked 16 hours in a row or more at a factory. It's less stress. There is stress involved. There's always someone breathing down your neck. There's stress. You're worrying about fucking 18 different fucking patients in the emergency room, trying to keep their fucking everything collected and stuff. You work long hours. The on-call doctor, not the on-call doctor, the attending was scheduled for 18-hour shift. He was going to sleep there. They were going to give him, I think that's how it worked out, 8 hours and 2 hours off. And he lived an hour away, so he was going to sleep in a room, wake up, straighten the shit out, and work another 8 hours. You got to be on. Yeah, that's the responsibility you fucking took. You got to be fucking on. That's it. Like, I understand sometimes everybody needs a break. You need to go fucking sit on the toilet for an extra fucking 5 minutes, have a cup of water, go get a coffee, something. That's fine. That's fine, but fucking almost a half hour playing fucking Candy Crush? Are you kidding me? There's nothing you could have better been using your time for than Candy Crush. And I play Candy Crush. I know what the fuck Candy Crush looks like. That's some straight fucking bullshit. And, I hate it. I hate when it's happening to me. I can accept it's happening to me. Because generally, if I'm at the level to go, alright, they could be doing something else, it's because there's nothing internally fucking wrong with me. Like, when I had strokes, I was agitated, I got treatment, and it was still slow. It was still slow. They found out my brain had been bleeding for 4 days. This was when I was in rehab. Those strokes happened. My lips were purple, I couldn't feel my fingertips, and I had a tingling sensation through the back of my neck, and this eye was about like this. And I went in there, I was like, I've been having trouble breathing. Like, I told them all my symptoms. Yeah, that's no problem. They hooked me up to an EKG. I was on the EKG for an hour. It was 2 hours before someone came in. They told me I had to do a CT scan. Might have been an MRI. I'm not sure about this. It was very foggy. I think it was an MRI. Now that I'm looking back on it for your head. They did the MRI. After about 2 hours more of waiting, they did the MRI. After the MRI, nobody came and talked to me for 3 hours. I had a hemorrhage in my brain at the site of the stroke. And I was actively laying there dying for 7 hours. That is on me. If I went in 3 days earlier, I probably wouldn't have been bleeding so severe. My symptoms wouldn't have been so severe. It would have been okay. But still, why does someone going there because they have a fucking flu and they're looking for antibiotics? You don't get antibiotics for a flu. That was retarded. People go there with bronchitis, pneumonia. I feel like absolute shit. I can't wait to go to the doctor, so I'm going to go to the emergency room. You get tons of people like them motherfuckers. Don't. There's free clinics set up. Yeah, they might be far away. You can figure out a way to get there if you're that sick. Don't go to the ER and fucking waste people's time because you have a fucking headache. Because you get the sniffles, you get a little wheezing going on. That's not what the emergency room's for. The only exception to that is because I've done it and I will fucking punch somebody in the motherfucking mouth if they tell me not to do it. My daughter was sick. She was 1. I brought her to the emergency room. I said, fuck this, I ain't waiting for a fucking doctor. She's a child. That's the difference. And the exception is obviously, too, the elderly. I can eat a flu. I've had the flu. I had a flu a couple months ago. I worked through it. I functioned the whole time. I would be at work fucking framing something and be halfway through getting a screw in and fucking throw up all over the fucking place. Stop, get the shop vacuum it up, paper towel the rest up, and continue about my day. Sweating bullets, not able to eat fucking garbage. I can do that. An infant cannot do that. It will kill an infant. How much... Because I can throw up and then go... chug a bunch of water, replace the fluids to the best of my ability. An infant can't do that. We had to put Emma on Pedialyte to make sure she was getting fluid because she was throwing up that much. And it got to the point where she stopped pooping and she stopped peeing. And I was like, fuck this, we're going. I was like, I don't care that her doctor's appointment is tomorrow. You're going fucking right now. Same with the elderly. They can't fight shit like that. They can't. How much do you think they can possibly sacrifice to lose? Like, if you're elderly or sick, because my mother's got Lyme disease. I don't talk about her. I don't talk to her much. She's got Lyme disease. She's very sick. If she gets a flu, it's intensified. She's got to go to the emergency room. Someone like me, 25 years old, I can lift fucking 350 pounds. If I get the fucking flu, I'm going to work. If it gets that bad, I'll make a doctor's appointment. I'll go to the fucking doctor. I'm not going to the emergency room. I'm not wasting people's fucking time. Because I've been in there where they were going to take me and there was another small child, I'd say 3, bleeding. Fucking nose gushing blood. You could tell they look clammy. Like, oh, Matt? I go, no. Like, what do you mean no? I was like, can you take this bleeding baby? Like, it's a baby. She's like, oh, we just do everything in order. And then, obviously, like, severity, like, I'm 25, I go in there with fucking... That's when they found the tumor in my chest, anyway. Intense lung spasms is what drove me in there that time. It was a bleeding baby. And they're like, well, you're having breathing issues. The baby possibly just has a broken nose. I said, all right, I'll leave and go to a fucking different hospital if you don't take the fucking baby first. That's who I am. I'm not saying if you're sick, anybody else is less important or more important. But that's what I'm talking about. If all the beds are full of people with the fucking sniffles and someone comes in that needs the fucking bed, don't be that guy. Don't be that girl. Don't be that person that fucking goes in there and wastes fucking resources. It's bad enough that the doctors and nursing staff themselves are generally wasting themselves. They are the resource, and they waste themselves all the fucking time. Don't add to it. Don't. And that's what me and my buddy Ray were talking about this morning. How the fucking government, he's blaming Trump. That's fine. You can blame whoever the fuck you want. Obama had his saying it too. The Bushes had their saying it too. It's been fucked for a while. Our healthcare system is fucked. Canada, universal healthcare. You got the sniffles, you go into a doctor's office. Here's this. Have a nice day. You don't get a bill. It's universal healthcare. You cut your fucking leg off, ambulance rides free, hospitals free, surgeries free, rehabs free, medications are free. The U.S., the pharmaceutical corporations are too fucking big. Everybody's a lobbyist, whatever, blah, 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 blah. Our healthcare system's been fucked up the whole time. My girlfriend going to the emergency room last night is going to cost her about $585. Rough total. She did it in Canada. It was free. That's fucked up to me. They can't refuse treatment. If you go in there with a gunshot, they have to give it to you. If you need psych meds, they have to give it to you. That is still in place. I shouldn't have to decide whether or not, a broken arm is worth missing a day of work to go get it set. I've done that. My elbow has a piece missing out of it. You can't see it anymore, which is good. You can a little bit. But I had to make that call. If I went to the emergency room, no matter what was wrong with my elbow, I was going to miss a day of work. Money was that tight at that point. I couldn't miss a day of work, so I didn't go. I went into the emergency room 4 days later. They said you chipped your elbow and fractured it. You know, we can put you in an isolating cast, keep your fucking arm straight like this. I was like, I work in a factory, no. I was like, I'm just going to have to eat it. I'll take ibuprofen. I'm good to go. But, you know, that shit just pisses me the fuck off. It really does. Like, don't sit there and fucking play Candy Crush. Like, at least do something. I don't know, but we are past the time. So if you watch, thank you very much for watching. And I'll catch you definitely tomorrow, because I have work in the shed tomorrow. You have a good one.